Good morning, students. Welcome back to Pharmacology Made Simple. In the previous classes, we have discussed about the absorption of the drug and the distribution of the drug. In today's class, we will be learning about the metabolism and excretion of the drug. Biotransformation or metabolism. Biotransformation is the process of biochemical alteration of the drug in the body. So, what is biotransformation? It is the process of biochemical alteration of the drug in the body. So, where does it occur? The site. The most important organ of biotransformation is the liver, but drugs are also metabolized by the kidney, gut, mucosa, lungs, blood, and skin. So, most of the time, the metabolism occurs in the liver, and that is known as the first pass metabolism. So here is an image about the biotransformation. So what happens is an active drug will be metabolized, or an inactive drug or a prodrug will get metabolized to form an active drug. So what are the consequences of biotransformation? The consequences of biotransformation are that generally inactive drug, some drugs may be converted into metabolites which are also active or more active than the parent drug. Okay, so from the inactive form it might get converted to the active metabolites. Biotransformation may also activate an inactive drug. When the metabolite is active, the duration of action gets prolonged. Okay, so this is very important. So what it does, the active metabolite, it will prolong the duration of action of the drug. Prodrug is an inactive drug which gets converted into an active form in the body. In case of some drugs, the active metabolite may be toxic. For example, paracetamol is converted to N-acetyl P-benzoquinamine, which causes hepatotoxicity. Cyclophosphamide is converted to acrolein, which causes bladder toxicity. Therefore, we should be careful which drugs are being given. So here again we see the consequences of biotransformation. So from the active drug to the inactive metabolite, and from the active drug to active metabolite, and from inactive drug to active metabolite, that is the prodrug. So what are the examples? From active drug to inactive metabolite, it is example is morphine and chloramphenicol, whereas the examples for active drug to active metabolite are primidone gets converted to phenobarbital, digitoxin gets converted to digoxin, diazepam gets converted into oxazepam. Whereas for inactive drug to active metabolite, the examples are levodopa gets converted to dopamine, prednisone it gets converted into prednisolone, and enalapril gets converted into enalaprilat. So here again we can see what the drug is doing to the body when it is taken orally. What happens in the brain? It might be the target affinity. In the blood brain barrier, what happens? There will be the distribution and the membrane penetration as well as efflux transport. Whereas in the circulation, again, there will be the distribution of the drug, the plasma protein binding or the serum albumin binding may occur. Whereas in the stomach, the tablet disintegrates, there will be the solubility, absorption, and membrane penetration. Also, efflux transport might happen. In the liver, mainly it will get metabolized by the CYP enzymes, and in the kidney and gut and rectum, it gets excreted. So, what are the enzymes in the biotransformation? The biotransformation reactions are catalyzed by specific enzymes located either in the liver microsomes, that is, the microsomal enzymes, or in the cytoplasm and mitochondria of the liver cells, and also in the plasma and other tissues, that is, the non microsomal enzymes. Okay, so there are two types of enzymes, that is, microsomal enzymes and the non-microsomal enzymes. The chemical reactions of biotransformation can occur in two phases, that is phase 1, which is called as the non-synthetic reactions, whereas phase 2, it is called as the synthetic reactions. So in phase 1 reaction, what happens? Here, the drug gets converted to a more polar metabolite by oxidation, reduction, or hydrolysis. Oxidation reactions are the most important metabolizing reactions, mostly catalyzed by the monooxygenases present in the liver. Okay, so what are the reactions which are causing the phase 1 reaction? It is the oxidation, reduction, or hydrolysis, and the most important of those are the oxidation reactions. Whereas in phase 2 reactions, what happens is the endogenous water soluble substances like the glucuronic acid, sulfuric acid, glutathione, or an amino acid combine with the drug or its phase 1 metabolite to form a highly polar conjugate, which is inactive and gets readily excreted by the kidneys. The large molecules are excreted through the bile. So here what is happening in phase 2? The endogenous water-soluble substances are combining with the drug or its phase 1 metabolite to form a highly polar conjugate, which is inactive and which will get excreted by the kidneys. So here you can see the pathways of the drug metabolism, be it the oxidation, which is the phase 1 reactions, or the conjugation, which is the phase 2 reactions. Okay, so in the phase 1 we said that the metabolite will get converted into the polar species and it will get eliminated in the urine, whereas in the conjugation reaction it can again form the stable adducts or it can form the non-polar species and get excreted through the biliary elimination or the stool. What is enzyme induction? Microsomal enzymes are located in the microsomes that line the smooth endoplasmic reticulum of the liver cells. The synthesis of these enzymes, mainly the cytochrome P450, can be enhanced by certain drugs and environmental pollutants. This is called enzyme induction, and this process speeds up the biotransformation of the inducing drug itself and other drugs metabolized by the microsomal enzymes. So what is happening here? These microsomal enzymes, they line the endoplasmic reticulum of the liver cells and they will enhance the effect of the drugs. Okay. So here the examples are phenobarbital, rifampicin, alcohol, cigarette smoke, DDT, and carbamazepine and phenytoin and some enzyme inducers. What is enzyme inhibition? Some drugs inhibit cytochrome P450 enzyme activity. Okay, so drugs like cimetidine and ketoconazole bind to cytochrome P450 and thus competitively inhibit the metabolism of endogenous substances like testosterone and other drugs given concurrently. Enzyme inhibition by drugs is the basis of several drug interactions. Examples are chloramphenicol, erythromycin, ketoconazole, cimetidine, ciprofloxacin, and virampal are some of the enzyme inhibitors. So here we can see what happens in the competitive inhibition. There is an enzyme, there is a substrate which wants to get attached to the enzyme, but there is an inhibitor or inhibitor enzyme drug which will come and get attached to the enzyme, forming an enzyme inhibitor complex. Therefore, the substrate will not be able to get attached to the enzyme, and therefore no reaction will occur. Okay, so the inhibitor binds to the active site and directly blocks the active site. What are the factors affecting the drug metabolism? There are various individual variabilities in the drug metabolism, such as the genetic differences, age, the diet, the environment, drug interactions, gender, and disease states. Okay, coming to genetic variation, it results in altered metabolism of the drugs. Example, succinylcholine are metabolized very slowly in people with defective pseudocholine esterase, resulting in prolonged apnea. Whereas in environmental pollutants, cigarette smoke can cause the enzyme induction. And in age, at extremes of age, the activity of metabolic enzymes in the liver is low, and hence there is increased risk of toxicity with the drugs. And diseases of the liver markedly affect the metabolism of the drugs. So these are the factors that influence the biotransformation. Next, moving on to the excretion of drug. First, we see the renal excretion. The kidney is the most important organ of drug excretion. The three processes involved in the elimination of drugs through kidneys are glomerular filtration, active tubular secretion, and passive tubular reabsorption. In glomerular filtration, the ionized drugs of low molecular weight, less than that of 10,000, are easily filtered through the glomerular membrane. So mostly it is the ionized drugs which have the low molecular weight which are going to get filtered out through the glomerular membrane. Whereas in active tubular secretion, the cells of the proximal tubules actively secrete acids and bases by two transport systems. Thus, acids like penicillin, salicylic acid, probenzid, furosemide, and bases like amphetamine and histamine are excreted through the active tubular secretion. Whereas in the passive tubular reabsorption, the passive diffusion of drug molecules can occur in either direction in the renal tubes, depending on the drug concentration, lipid solubility, and pH. As highly lipid soluble drugs are largely reabsorbed, their excretion is slow. Therefore, acidic drugs get ionized in the alkaline urine and are easily excreted, while the bases are excreted faster in the acidic urine. Here we can see the image of the drug excretion. Mainly it will happen in the kidneys or in the liver, but it can also happen through the lungs, milk, sweat, ears, skin, hair, and the saliva. Coming to the fecal and biliary excretion as well as the pulmonary excretion. Here in fecal and biliary excretion, the unabsorbed portion of the orally administered drugs are eliminated through the feces. Liver transfers the acids, bases, and unionized molecules into bile by specific acid transport processes. Large water-soluble conjugates are excreted in the bile. Whereas in the lungs, It is the main route of elimination for gases and volatile liquids. Example, the general anesthetics and alcohol. The other routes of excretion are sweat and saliva. Excretion in saliva may result in a unique taste with some drugs like phenytoin, clarithromycin, giving the metallic taste with metronidazole, metoclopramide, and disulfiram. Drugs like iodide, rifampicin, and heavy metals are excreted through the sweat. Okay, this is about the biotransformation and excretion of the drugs. The important questions from this topic could be: what is biotransformation? Explain the phases of biotransformation for 5 marks. What is the role of enzymes in the metabolism of drugs for 5 marks? Excretion of drugs for 5 marks. Enzyme induction for 2 marks and enzyme inhibition for 2 marks. If you like my video, please do subscribe, like and share the videos with others so that it could be useful to the students who need this information. Thank you.